Dr. Alka Patel, thank you so much for coming on Wellness Your Way. I'm thrilled to have you here.
Oh, likewise. I'm excited for our conversation.
As am I. Well, I've just been through your formal bio with my audience, but please let us know a little bit about yourself.
Oh, wow. That's always a bit of a tricky question, isn't it? It's like, where do you actually start?
Yes.
So maybe it's worth me just identifying myself by the three top words that I would use to describe myself.
Love it.
Yeah, and have thought about this. What is it that, how do you show up in the world? And for me, it's this sense of wonder that I have. So I'm constantly wondering about what people are saying and how I'm showing up and how things are even possible in this world. So this sense of curiosity is a really kind of strong part of me. Another part of me is about stickability. So starting something, seeing it through, wanting to see it through, adapting with it, but just sticking with it. I found that's a trait that comes through quite strongly in me. And I think the third word to describe me would be something around zest. So that sense of zest and energy. So I do like that word as well. So those are probably my three words to describe myself. Maybe a little bit more. I'm mother to 3 children.
Amazing.
I am friend to 2 dogs, and I am wife to just the one husband.
That's wonderful. How old are your children?
Oh gosh, 21, 20, and 16. So wonderful
wow.
age. Yeah.
Fun and challenging ages in their
Oh,
own
yes.
right. So you have just a little bit on your hands with those 3 children, 2 dogs, and 1 partner. And you are also super accomplished in the medical and health world, which is what we're here to talk about today. So I'm very excited to share some of your insights with our audience. I'd love to start with your transition from prescribing medications to, as you say, prescribing lifestyle practices. Could you tell us about that transition?
Yeah, gosh, it does sort of take me back a little bit. I think with many people who have a transition, there is always that penny drop moment or that life experience in your own life that makes the change for you. And for me, there was a point where I experienced a significant amount of stress and burnout. I can call it that now, but at the time, I didn't really want to call it any of that because I was this high-flying professional GP, doctor, lots and lots of titles and accolades. And when something hits you, when the fragility of life hits you, it gets you to really reflect and think, what am I doing? And so when I went back to my practice, it took me a long time to recover, several months. When I went back to my practice, I was almost able to see myself from a different perspective. And unfortunately, I saw myself more as a drug pusher than anything else. Anything else, every single consultation. And, I don't say every single lightly. That was almost the sense that people coming to see a doctor, there's an expectation that there's a prescription that's slid across the table.
Yes.
And the moment I recognized that, I really reflected on what benefit am I providing to my patients? What help am I really given? When you go to medical school and you go to those interviews, there's that question that says, why do you want to be a doctor? And of course, who doesn't say, I want to help people? And I went back to that and I thought, am I actually helping? And because of my burnout experience and the recognition that actually, for me, I needed sleep and to eat well and to rest and to connect with my family and to just enjoy life in order to thrive, that's what I knew I needed to take back to my patients. So I switched totally to prescribing a lifestyle. Not that medication doesn't have a part to play, but it's positioning. Let's position our lifestyle first, which is my brand, because it is really about, let's elevate that as being super powerful, and let's have the medications and the surgery and the drugs and the vaccines and all of that as the sort of condiment on the plate if we need it.
Yes. Oh, I love that. As a holistic nutritionist myself, I love all of the lifestyle practices. And I believe I've, of course, taken medications, will take medications in the future when needed. I believe in the power of that when needed. I just think that we expect it a lot more than is often needed. I think the tension in what you said between people who are now saying, okay, I recognize antibiotics are overprescribed. I recognize medication's not the answer for everything. And yet I still go to the doctor expecting that paper slid across the table. Not me personally, but people in general. Do you see a lot of resistance to that when people come to you and they don't get a prescription now?
So that's a really interesting question, because there is that sense of resistance, but I tend to switch that to responsibility, to really changing the ownership of health. And when I can give you a sense of, you want to be responsible for your health, you don't want me to be responsible for it, this is yours,
Yeah.
then the resistance changes. But of course, it's never a quick fix. It's not as quick as popping that pill. But once you've taken that sense that I am 100% responsible for the outcomes of my life, then we can start the shift.
Oh, I love it. I love it. And speaking of taking responsibility, you have a great TEDx talk, which we will link in the show notes. I really enjoyed watching it. It's called Health is a Verb, Not a Noun. Can you give us a preview of what you mean by that?
Yeah, I think that follows on from what we've just been chatting about, really.
Yeah.
So I think, really the problem that I've seen throughout my career, and I'm now talking about over 500,000 patients, is that expectation that health is something that you can just have. You can just own it and you don't need to do anything else with it. And it's a bit like objectifying your health, isn't it? You've got things, we've got objects, we've got phones and the computer that we're on, but they all need taken care of. They all need upgrades. You've got to put your computer onto sleep mode and turn it off regularly. Otherwise, it's working really hard in the background. If you overcharge your phone, you know that it just stops working so well. Its efficiency changes. So it's no different with your health, which is why my TEDx talk was very much centered on, what are you doing with health? Turning health from a noun into a verb. Upskill yourself. Feel like you want to optimize your performance, because if you treat it like a skill,
Yes.
instead of just something that you have, then with any skill, you're going to want to keep upgrading it. And you know that you can optimize it and optimize it and optimize it. So that's really what I wanted to convey through my TEDx talk, but more so the emotion behind health and health empowerment, because you have to feel that, again, back to responsibility and ownership and accountability and connection, and the emotion that goes with feeling healthy, what that gives you as a person, how you can show up in the world when you're at the peak of your health. Because only when you're at the peak of your health, you can be at the peak of your performance, right?
And when you focus on that, how you feel at your best in the peak of your performance, then the work becomes a lot less work and more a joy of taking care of this gift that is my health, my constantly evolving health, not just this thing that I bought at the store once and I never have to worry about.
Yeah, exactly that. Yeah, absolutely.
So in this TED Talk, you mentioned the lifestyle habits. I am a super acronym lover. So I love that you also share my love for acronyms. Your first letter of your acronym for lifestyle is L for life's purpose. And in life's purpose, you suggest taking 9 minutes in the morning to contemplate the day. I am a huge morning routine person, so I loved this one. Can you share a little bit about life's purpose, that L?
Yeah, for sure. I think the question that people often ask is, how do I find my life's purpose? And there's this real sort of ethereal sense to it, isn't there? As though it's something outside of you and you've got to go on this sense of seeking it out and this pilgrimage to find that. But there's a very much more simpler way, and it all just starts by asking yourself a question, just because at the end of every question does lie an answer. And we don't really pause to ask ourselves questions because we're so busy doing and being busy with our day. But just if you take a pause and just ask yourself a simple question, what do I want? And allow that to flow. And then it's, what do I really want?
Yeah.
And why do I want this? What does it give me? And what does it give others? Now, these might not feel like easy questions to answer, but if you give yourself space and the place to be honest, that purpose is within you. You're not on a crusade to go and find it. And interestingly, though, we have to accept the reality of life, which is that life is busy. It is. We're constantly engaged in activity with these extra long to-do lists. And what I did last month, actually, was I stepped into silence for 7 days.
Wow.
And I didn't say a single word, not a word came out of my mouth for 7 days.
Amazing.
And you know what? That for me just allowed myself to hear my own chatter.
Mm-hmm.
Because we don't hear ourselves think. So when you ask yourself the question, what do I really want? You don't know because you haven't actually paused to hear your mind. So if you can just start to just step into silence, I'm not saying everyone needs to go and sit in the mountains for 7 days, but allow that stillness, but even for just 60 seconds,
Yes.
60 seconds of stillness, ask yourself the question, what do I really want? And pour it out.
Mm-hmm.
That will come for you. That sense of purpose will develop, and keep the focus on the purpose for today. Not this ethereal, my entire life, because if you have purpose today, then that will create purpose from yesterday and tomorrow, and then every day, every month, every year.
Oh, I love it so much. I've done a 2-day silent retreat, but that has been the maximum. You're inspiring me to push further. I believe it is so powerful. So bravo to you. I love how you finished that. What is my purpose today? I think that's so doable for people. What do I want today? How do I want to show up today? What's important to me today? That feels like a bite-sized chunk that people could get used to doing. And as you said, that will lead into bigger purposes. I don't believe that we have to identify our one single life's purpose when we're 15 years old and it never changes at all. Life's a journey. So as long as we're continuing to ask ourselves that and continuing to be honest and reflective, we're making progress.
Yeah, totally. I'm totally with you. And allowing that sense so I can flex, I can change. I am agile and not being fixed, because we often get fixed on the end goal and we forget to enjoy that journey there, don't we?
Yes. Oh, now you're speaking to me. I can do that sometimes. I get fixed on the end goal. So thank you for the reminder. I'd like to do one more of your letters in the acronym lifestyle, which is T for timeout. Now, you talked to us a bit about your journey with stress, and even on your website, you use the quote, a crash course in burnout, which made me sad and chuckle a little bit, but not at your expense. I love that you're focusing on managing it very well now. What are a few things you do to focus on your stress right now?
Oh, that's a really interesting question. Where do I go to focus on my stress? I think the first thing has to be about awareness. So I tend to make sure that I'm noticing myself and have this sort of regular check-in through the day. Again, a simple question, how are you doing? Just to myself, how are you doing? -10 to +10. And if it's a -2, it just gives me a nudge to say, I don't want to be there. What can I do to elevate that in that moment? And that might be as simple as standing up or shaking around or cuddling my dogs or going to have a joke with my children, whatever that is. If you don't check in, if you don't notice, you can't nudge yourself. So that's the first thing, I think, is just to recognize when that kind of, you're not at that level that you want to be, the stress is kicking in.
Yes.
The second is, and this is something that I really embedded in those 7 days of silence, was this sense of gratitude. And we talk about it a lot now, don't we?
Yes.
But when those stress levels peak, it's so easy to fixate on what's causing the stress or what those triggers might be. But if you just change that focus and just look at life from that sense of gratitude and abundance and the ability to be here, that's a real stress shift. That's a very, very quick stress shift. And the other thing, the third thing that's be really, really key, is the other thing that's with us always, which is our breath.
Yeah.
And tapping into the science of that. There's a whole art to breath work and breathing, which has come over from the East from over 4,000 or 5,000 years ago. But now here in the West, we can suddenly attach science to it and recognize that we're activating our parasympathetic nervous system when we slow down our breathing. And when you do that, you're automatically out of stress mode. You're much more peaceful. The clarity is different. And again, I talk about, 60 seconds, do that for 1 minute. That's what I do when I notice. I've got to notice the signs. I've got to think about what I'm grateful for and then check in on my breathing and change that. And the stress changes because I change my physiology very, very quickly.
Yes. So wonderful. Do you focus on slowing down your breath or just awareness of breath or a particular pattern?
So absolutely slowing down my breath, because again, of course, I'm a medic and love the science behind all of this. There's a part in your brain called the locus ceruleus, and that is almost like your breathing pacemaker in your brain, and it connects with the rate of your breathing. And what the locus ceruleus does is it sends out information to all the stress areas in your brain as well. So if it's slowing down in terms of how it's receiving those signals, then it doesn't send out those signals to the stress area. So if you slow down your breathing to less than 6 breaths a minute, then actually you activate your, as I said, your parasympathetic nervous system. So that's my magic number. And again, it's pretty easy, in for a count of 4 and out for a count of 6. And you do that for 60 seconds and that's it. You're activated the pathways that you need. So that's my key focus. Yeah.
I love it. When you said in for 4, out for 6, I always encourage people to make the exhale a bit longer when possible, again, for the engagement of the parasympathetic nervous system. So I like that. And also what you said, which is 6 breaths per minute. I'm thinking about that. I guess in for 4, out for 6, that's about 10 seconds. So you've done it right there.
Yeah, exactly.
Wonderful. Okay. One thing that fascinated me when learning more about you is that your biological age is almost 30 years younger than your chronological age. I've heard the gamut of different practitioners saying, oh, I'm 1 year younger, or I'm 3 years younger, or maybe I'm 7 years younger, but 30, I have never heard that. So please, could you tell us your secrets? Tell us how this is measured and what you attribute this difference to.
Oh, yeah, for sure. So, I mean, certainly in terms of the secret, it's everything that I talk about in terms of lifestyle. So I have a methodology, which you'll see on my website, the Lifestyle First method, which is all those elements that we've, some of which we've been chatting about today, that actually design the lifestyle that ultimately does reduce your stress and in turn changes your aging trajectory. So in terms of measuring that, if we go back to the root, what is happening to us in terms of the aging process? Well, there's this process called inflammation, which I'm sure you've probably talked to on previous episodes with your audience. And inflammation lies at the absolute root of my favorite word of the moment, which is inflammaging.
Yes.
Right. And so what you're doing is by causing inflammation in your body, you trigger inflammaging that then speeds up the aging process. So if you can reverse engineer all of that and reduce inflammation, then of course you're going to reverse aging. And that's exactly what I then measure in terms of how do you measure your biological age. And we need that number. We love numbers. Numbers give us the nudge to make a change. So once you know your biological age, you're absolutely going to want to do something about it. If it's higher than your chronological, you're like, I need to change that. And if it's lower, you want to know what you need to do to maintain that, right? So either way, that number is so important. So what I measure is something called your glycans. So your glycans, how can I describe them? They're like simple sugar molecules that attach to your immunoglobulins. So your immunoglobulins are one key protein which form part of your immune system. So if you think about it, we are one big defense organization, aren't we? Constantly defending ourselves to stay alive and to stay alive for a long time. So these glycans modify the presentation of your immune system so that you're either in a pro-inflammatory state or an anti-inflammatory state. And the way you modify your glycans is through your lifestyle. And that's the way then to reverse aging and be, absolutely 30 years younger.
So incredible. And isn't it true, it's a convenient acronym, isn't it true that the glycans can form advanced glycation end products, which spells age? So these glycans are an easy way to remember it, a direct measurement of aging, as you said.
Yeah, and that's really important. I'm glad you've raised that, because what you want to be sure is that whatever you're testing has got a direct correlation with outcomes. So glycans, as you say, are a very, very strong predictor of future disease. And we have to remember that, because that's what we're trying to prevent. We're trying to change your trajectory in terms of the prediction. So if you've slowed down your aging, then your prediction for getting other diseases is changed as well, because many diseases come with aging. And there's certainly a school of thought that I'm buying into, that aging itself is the fundamental disease. And if we change that, then everything else, like a domino effect, will change as well.
Yes. I actually have not measured my glycans or my ages or my telomere length, anything like that. I can use in my own self a semi-good proxy of CRP for inflammation or GGT or something like that. And I always struggled with, okay, if my inflammation is high, it must be something, it must be one food, or it must be, where's the mold exposure? Where's the one thing? I tried to avoid so much the stress that is the center of your lifestyle first approach. And I had to face the facts that it was the stress for me as well. And I think for so many people, it was just hard for me to connect that dot between stress is causing physiological damage, not just me not feeling good emotionally, but physiological damage. So I'm glad you're shedding light on that. Thank you.
Yeah, for sure. And the stress, just like aging, no one wants to talk about it. We don't want to say, I feel stressed. It's really sort of feels like an admission of, well, I'm not good enough or I'm too weak. And so we don't talk about it. But there are so many elements that add to stress. And it's maybe the stress of external events like the wars, it's the stress of grief and loss perhaps in the family, but even the stress of where are my keys today? All of these just add up. So it doesn't mean that you're stressed, but exactly as you said, that physiological response to where are my keys, and that is going on constantly all day long, is then what triggers this chronic stress response.
Yes. So if you are finding yourself in that where are my keys mode all day, like, okay, the emails are coming in, you have this interview, you're go, go, go. Is it what you said? You pause, you express gratitude, you focus on your breath work. Is that enough of a reset to reverse some of the damage of this constant, where is my keys?
It's definitely a start because all of this is at our fingertips, but I'm very much more about the strategic, I call it strategic self-care, because we can do what our friends tell us. We can do what's off the shelf or what the latest fad on Instagram is, but you have to know your own pathways.
Yes.
You have to know your own drivers. If we take something like weight, for example, and often such an emotive subject to talk about, is people have different drivers. For some, the driver for weight gain is cortisol, it's the stress hormone. For others, it's food and insulin. For others, it's not sleeping and melatonin. So you have to know your own pathway and make absolutely no assumptions. And we are right now, Megan, aren't we? We're living in the most incredible of times where you can access this data about you. I can send you a finger prick test home tomorrow and we can get that data and we can zone in on the uniqueness of you rather than what it might be or could be. And we don't have to guess because we're busy. Everyone's busy and we're too busy to guess. We don't want a life of guesswork. You want that strategy behind it. So yes, all these modalities are absolutely at our fingertips, but what I would stress to listeners is know your data. Absolutely know your data.
Oh, I love it. I'm a data fiend myself. And stress, the implications of stress goes even beyond just feeling icky, like we said. Let's talk about some more chronic diseases. So you've said in your TED Talk, heart disease, this is a quote, in fact, heart disease, cancer, diabetes, dementia are preventable simply by shining a light on your lifestyle. Your health, your lifestyle, how you sleep, rest, move, eat, connect doesn't just impact you, they impact those around you. I would like to put this quote all over my office and everywhere in the world. It's so empowering, honestly, to hear that. I think that we need to hear more often that even these chronic conditions that in the past were a sentence that we couldn't do anything about, there's something we can do. Can you tell us more about that?
Oh, for sure. And that's really interesting that you've positioned it like this, because I've changed the way I tell my patients their diagnosis. In fact, I'll tell them what the diagnosis is, but very quickly it's followed up with, do you want this? And if you don't want it, then we can do something to get rid of it. If you do want it, then all right, we'll give you the drugs or whatever else that might help. But nobody wants it. No one ever says, yeah, I want depression. I'll have acne. I'll take the arthritis. Nobody wants it. So if you don't want your diagnosis, then you are in a position to actually get rid of it. And if you start with that mindset, that I can get rid of this. This doesn't
Yes.
have to be part of me. Then you're going to be able to change that trajectory. So take the example of depression. So you've probably come across this in the sort of nutrition field as well, but the SMILE trial.
Yes.
And this was a fabulous trial, wasn't it? Where we took two groups of people with depression and low mood, and one group carried on with their normal antidepressants and therapies, and the other group focused on food as an intervention. So very much that sort of Mediterranean type diet, nuts and seeds, lots and lots of vegetables, a little bit of meat and fish as well. And the results, honestly, they were staggering, absolutely staggering. So only 8% of people who were taking the medication, they reversed their depression in 12 weeks, compared to 32% in the food group.
Wow.
And look at that, just marinate on those statistics just for one moment. It's that food affects mood. And so why are we not talking more about this and elevating those statistics? And that's the conversation that you have with your doctor or your friend or your neighbor, and that you actually take hold of this, because every mouthful that goes in your mouth, you choose, right?
Yes. Yes. The food, I like to remind myself, the food we eat is literally becoming our body, becoming our future, becoming our thoughts and our emotions and all of this. And do I really want to become a Cheeto or a Dorito or a something? No, I want to become a beautiful, alive, vibrant, with colors kind of person. And so that's what I choose to put in my body.
I love that. Do I want to be a Dorito? Brilliant.
Well, my example's silly. Your example is incredibly powerful when you say, do you want this diagnosis? And I venture to believe, like you said, virtually zero, hopefully zero people say, yes, that I want it. None of us want this stuff. So whoever you are, audience member, whatever you're dealing with, just hear that you can do something about your situation with your lifestyle. You can go to Dr. Patel's website and just get a head start with these lifestyle practices and truly change your future. I believe that so strongly. I love what you're doing. Could we share 3 important pieces of data, since you were talking about data, 3 important pieces of data that would give people a pulse on how their body is doing right now?
I think we've probably touched on some of this already. So when I think about vital signs, let's maybe think about your ABC first of all. So we've talked about age. And I think that is an absolutely important piece of data that we should all know, not the number of candles on your cake, but really your cellular level aging. Everybody who is listening, I would absolutely advocate for you to check your glycanage. You're very welcome to get in touch with me and understand how all of this works. But once you know that number, as I said, your age is your trajectory and you can change it. So that's the A. For B, we touched on this a little bit as well, is breathing. You've got to, again, check in. How fast am I breathing? How deep am I breathing? Can I slow my breathing down? So this is a vital sign, right? Just check in on that, hand on chest, and just count 60 seconds and know that number, that piece of data, and then change it. And the third one is, you talked about pulse. So circulation. In your circulation, you need to know your blood pressure. You know, it's one of those silent ticking bombs. When's the last time you checked your blood pressure? You need to know that number, because you'll only know it when you have your heart attack or stroke, but actually you're in a position to change it with your lifestyle. So know your blood pressure, and the other part of your circulation is your heart rate variability. So we've got, again, great gadgets, you know, watches and rings and all beautiful things that we can now got at our disposal to measure that, because your heart rate variability is a direct prognostic indicator of your stress as well. And so monitoring that. So that's the ABC. I'd probably add a D and an E if I can to the vital signs. So D is your DNA. And I get very excited about testing all of my clients' DNA, because this is how we're made. You uniquely are made. And now you can know that about yourself. Your DNA, if you have a DNA test, it tells you your chronotype. So whether you're a natural, genetically predisposed morning lark or a night owl. And then imagine shifting your rhythm to match that. Your productivity changes, that your eating patterns change, everything shifts. So there's so much you can know about your DNA, your exercise endurance, the way you metabolize carbohydrates, everything that you do. So I would encourage people to know this about themselves and use that. So that's A, B, C, D, and E is energy, data about your energy, because again, what are we if not a vessel for energy? So know your glucose, because that's our primary source of energy. And for many of my clients, we'll have little glucose monitors on our arms. Yay, there you
I got one.
Because it's fun. Two,
It
it's
is.
feedback, right? And actually you get to know yourself. Me and you will eat the same potato and we'll react differently. We'll have different response. So don't just say no potatoes ever.
Right.
How you're responding, right? So that's the energy. And also precursors like NAD, which is sort of part of your how you turn nutrients to energy. It's a critical coenzyme, very much connected to aging as well. So know your metabolic data. I do a lot of very pathway related energy and metabolic related tests as well, which will give you so much insight. So that's my 5 vital signs: A, B, C, D, E.
A, B, C, D, E, another wonderful acronym. I have 2 super quick questions about those. With A, am I correct in hearing you say that audience members can contact you and get this test for aging from you directly?
Yeah, absolutely. I can arrange for that to be shipped out to you. You'll receive it at home. It's a finger prick blood test that you do in the comfort of your own home. Send it back. There'll be instructions and labels and envelopes, and goes directly to the lab. 3-4 weeks, we will know your age. So absolutely get in touch with me and I can organize that for you.
Oh, wonderful. I can't wait to do that myself and put the information in the show notes for the audience. And then last one, for heart rate variability. I love it. I wear the Oura Ring, and like you said, there are many devices, none of which are better than listening to our own body, but I do like the data and information. I describe heart rate variability as if your heart is stressed, if your body is stressed, your heart needs to operate militantly and be very rigid in its schedule, like a metronome. And then if it's more relaxed, there can be more variability between the beats. To me, it kind of makes sense, but I struggle communicating that to people. Can you do a better job at explaining heart rate variability?
Probably not, because you had me. You actually had me. I'd probably include something about rhythm in there, because when your heart rate is variable, it's flowing much more with your natural rhythms. Whereas if you're obstructing your natural rhythms with stress and changing all those pathways, your heart has to be super responsive to that. And so it moves away from its own variable nature. But I think you've explained it beautifully. Yeah.
Okay. Hopefully the combination of the two of us, we've gotten the point across. This is so wonderful. I could speak to you for hours, and I'm so grateful that you have so much amazing information on your website and via your TED Talk. We'll definitely direct our listeners there. Is there anything else you'd like to share with our audience?
Probably 2 things. One is that this is something else you'll find on my website, but one very common thing that I find with most people is they don't know where to start. And it can be really overwhelming sometimes, self-care and lifestyle and strategy and do this and do this and do this. So what I have created is what I call an LQ test. So it's a little bit like your IQ for your cognitive intelligence and your EQ for your emotional intelligence, but it's your LQ, it's your lifestyle intelligence. So a series of questions, you'll get a score about which areas of your lifestyle are really calling out for you to focus on. And allowing you back to kind of the beginning when we were chatting is ask yourself a better question. It's questions. So find the answer and then tap into that data. It's a number that you'll get, which will allow you to know what area of your lifestyle to really start focusing in on first of all, and then zoning in. And there's lots of resources I've got attached to that, and downloads and Spotify playlists and all sorts of things. So I definitely encourage people to just pop over to the website and take that LQ test. And I guess I'd love to leave everyone with a very final quote from me, really, which is, if you don't have time for your health today, you won't have health for your time tomorrow.
That's a powerful one. Yes. Thank you for sharing that. I hope everyone takes it to heart. If you don't have time for your health today, you won't have time for your health tomorrow, or you won't have health for your time tomorrow. Yeah. Wow. Wonderful. That's an excellent way to close. And thank you so much again for sharing all of your insight and wisdom. I very much appreciate you being here today.
Oh, no, lovely. This has been a fascinating conversation. It's been really good fun, lovely to share. And I wish everyone listening a really long, happy, healthy life.
Yes. With your help, they're off to a great start.